डॉक्टर अंजलि का आपके साथ और सेशन जरूर हो, तो ये हमारी आशा रहेगी। धन्यवाद डॉक्टर अंजलि। और अब इंग्लिश सेशन के लिए मैं हैंड ओवर करती हूँ डॉक्टर अंजलि को। धन्यवाद।
Thank you, Dr. Neha. Thank you, Sahani sir, and thank you whole in the team. Dr. Anjali, I was only last part of your lecture I heard. Actually, I missed your lectures. I think. Hope we'll meet.
Don't worry, Anjali. She will
Okay.
she will also come in English session next time.
Okay. So now it is the time for the English session. Today is our 1715th day of continuous webinar. Welcome everyone to this webinar.
Dr. Anjali, I am leaving. So I have made you the host. You know
okay, thank you.
Okay,
thank
so
you.
I am leaving now. Yeah, I'm just informing you. Yeah.
And before beginning the session, as usual, we'll have a silent prayer. Good evening and welcome once again. Thank you all the participants for being with us. And thank you all the faculties. Today's our speaker is Dr.UMMAI AFSHAN. She's a BHMS gold medalist and she's in dietetics. She's the topper of the batch. I think the basal homeopathy is bringing all the rank holders here. Last, I think on Sunday also when I am hosting, it was also a rank holder. So I'm welcoming Dr. Basil Yusuf is typing yes. Thank you. And I'm welcoming Dr. Afshan here. She's BHMS and MSc in dietetics, and she's a gold medalist, consultant in Basel Homeopathy, and she's from Bangalore. And she worked with VCare Homeopathy, Sanjeevani Homeopathy, Star Homeopathy, and for last 6 years, she was working in these 3 clinics, and she's now working with Basel Homeopathy. And today she's going to take the class about the hypothyroidism. Dr. Afshan, you are welcome.
Thank you very much, ma'am, for your warm introduction. It really feels good. Before I begin my session, I would want to thank Dr. Basil Yusuf, for giving me this opportunity to present on this platform. Okay, so my topic for today is how homeopathy actually helps in hypothyroid cases. So before we could get into the details of how homeopathy helps in hypothyroidism, let us first simply brief about what exactly is the brief anatomy and physiology. 1 minute, ma'am.
Okay.
My screen is visible?
Yeah, your screen is visible, but you are not visible. Your camera is, I think. Can you open your camera?
Dr. Ajini, visible.
Visible.
Visible?
Yeah. Dr.
Really?
Afshan is visible. Okay.
Okay then. Okay. Then you can proceed.
Okay, let us briefly have a look about the anatomy and physiology of thyroid gland. As we all know, thyroid is a butterfly-shaped gland. It is composed of 2 lobes, that is the right lobe and the left lobe. Right lobe, which is generally referred to as lobus dexter, and left lobe, which is generally referred to as lobus sinister. Both the lobes are connected with the help of isthmus. It is situated in the anterior side of the neck. It extends inferiorly to the 4th or 5th tracheal ring. It is covered anteriorly with infrahyoid muscles and laterally with the sternocleidomastoid muscle. Posteriorly, it is fixed to the cricoid cartilage and tracheal cartilage. Blood supply, it is through superior thyroid artery, inferior thyroid artery, and thyroid IMA artery. Venous supply is also from the superior thyroid vein and inferior thyroid vein. Nerve supply is through both sympathetic nerve and parasympathetic nerve. Through sympathetic nerve, it is superior cervical ganglion and cervicothoracic ganglion. Parasympathetic nerve, it is through superior laryngeal nerve and recurrent laryngeal nerve. So again, here what happens is most of the people who go for complete thyroidectomy or partial thyroidectomy, they generally have a chance of injury to the recurrent laryngeal nerve, because of which the surgeons generally tell them that you might have a risk of losing voice. So this is where applied anatomy comes into picture and our anatomical knowledge comes into picture. Now, let us study about the physiology, normally how T3 and T4 hormones are produced in the body. Basically, our cells and peripheral tissues, they require energy for metabolism. So what happens because of that, the hypothalamus in the brain, it gets stimulated to release thyroid releasing hormone, which in turn stimulates the anterior pituitary gland to release thyroid stimulating hormone. This thyroid stimulating hormone goes and stimulates the thyroid gland to produce T3 and T4. This TSH production is suppressed when T4 levels are high and vice versa. So basically what happens here is most of the hormone that is thyroid hormone that is produced is T4. 90% of the hormone that is produced, thyroid hormone, is T4, and only 10%, small portion, is T3. And the free thyroid is the one which is responsible for the hormonal activity. And only a fraction, a portion, is responsible for the hormonal activity. So generally what happens is, let us first see how thyroid produces T3 and T4. There is something known as thyroglobulin, which is a glycoprotein, which is produced by the follicular cells of the thyroid gland, and it contains tyrosine. So this, what happens is, thyroid, it takes iodine from the diet, adds on to the tyrosine to release T3 and T4. So this is where the clinical knowledge comes into picture. That is why they say that hypothyroidism is caused due to iodine deficiency. Inadequate amount of iodine in the diet is responsible for hypothyroidism. That is the reason why this comes into picture. So now let us study about the clinical significance. So what happens is when the T4 levels are high and the TSH levels both are high, it indicates that there should be some pathology in hypothalamus and pituitary. Thyroid gland is functioning absolutely normally. It could be because of the benign tumor of the pituitary gland, or sometimes what happens is thyroid hormone becomes resistant. Okay, so this resistance of the thyroid hormone could also be the underlying pathology. And next, what happens if the TSH levels are low? Thyroid levels are also, that is thyroid hormones, that is T3, T4 levels are also low. We can say that the pathology could be somewhere related to hypothalamus or pituitary. There is no problem with the thyroid gland. It could be because of hypopituitarism. Okay, now when the TSH level is low and thyroid levels are also low, it means that there would be some pathology within the thyroid gland. There is no pathology related to hypothalamus and pituitary, but there could be some pathology in the thyroid gland. It could be because of Graves' disease, or it could be because of hyperthyroidism. And when the TSH level is high and the thyroid hormone level is low, it could be because of congenital hypothyroidism, meaning to say the pathology is in the thyroid gland. So the hypothalamus and pituitary has nothing to do here. And there is something known as subclinical hypothyroidism as well, where T3 and T4 levels are absolutely normal. TSH levels are slightly elevated. This is what we generally see in our clinical practice. So this is where I want to say about the clinical significance part. Etiology of hypothyroidism. Before I could discuss anything about the etiology of hypothyroidism, I would want to tell you what exactly is hypothyroidism. Hypothyroidism is nothing but underactivity of the thyroid gland, meaning to say that there is no adequate synthesis of thyroid hormones. It could be main reason is iodine deficiency. Worldwide, the leading reason is iodine deficiency. But in United States of America, they say that autoimmune thyroiditis or Hashimoto's thyroiditis is mainly responsible for hypothyroidism. So now there is something like primary hypothyroidism, transient hypothyroidism, secondary hypothyroidism, tertiary hypothyroidism, and iodine deficiency being the leading cause. Primary hypothyroidism, what happens is the problem is with the thyroid gland. Thyroid gland is not producing adequate secretion of thyroid hormones. There is no pathology with the pituitary and the hypothalamus. It could be because of drugs, certain drugs. It could be because of congenital hypothyroidism, or it could be because of autoimmune disorders, or it could be because of subtotal or total thyroidectomy. And there is something like transient hypothyroidism. In transient hypothyroidism, it requires no therapy or short therapy. Okay, sometimes because of subacute thyroiditis or after delivery, there is inflammation of the thyroid gland. That could also be the reason for transient hypothyroidism, or it could be because of thyroiditis, or it could be because of silent thyroiditis. Now, the next is secondary hypothyroidism. In secondary hypothyroidism, what is exactly happening is there is problem with the pituitary. Pituitary is not secreting adequate amount of thyroid stimulating hormone. It could be because of hypopituitarism, or it could be because of hypothalamic diseases. Next is tertiary hypothyroidism. In tertiary hypothyroidism, the pathology lies in the hypothalamus. So what happens is hypothalamus fails to produce thyroid releasing hormone. So here in secondary hypothyroidism and tertiary hypothyroidism, there is no fault or there is no pathology in the thyroid gland. So this is about the etiology. As I said, leading cause for hypothyroidism is iodine deficiency. But in United States of America, they say that in their America, they say it is Hashimoto's thyroiditis or autoimmune thyroiditis, which is the leading cause for hypothyroidism. Hypothyroidism can also be seen in children, that is congenital hypothyroidism, which is generally referred to as the cretinism, is also seen. I just wanted to clear that point here. Pathogenesis, as we already discussed here. So what is happening? Thyroid tissue, there is loss of thyroid tissue and pituitary failure to synthesize adequate amount of TSH, which is leading to decreased production of T3 and T4, leading to hypothyroidism. So basically, this is what is the pathogenesis that is associated with hypothyroidism. Now, coming to the signs and symptoms. So what happens is hypothyroidism is closely linked with psychological symptoms also. They have mood swings. They are more prone to depression. Then they have mental, I can say concentration power is impaired. Memory power is also impaired. There are people who come to us and say that, Madam, I have opened the fridge, but I don't know why I opened the fridge. It all happened after thyroidism. I didn't have the tissue before that. So I just want to try and tell you that this is one of the signs and symptoms of hypothyroidism. Coming to hair, they have shaggy hair loss, alopecia, luster is lost. The shine of hair, the luster is lost. Okay, next coming to the thyroid gland. Thyroid gland becomes enlarged and it has an effect on heart also. The heart rate is very much slow, or it is called as bradycardia. Okay, and then coming to the sexual sphere, there is diminished potency and fertility in men. And in women also, you can see a low sexual drive, irregular menses, infertility. These are the symptoms. And coming to the skin part, skin is very dry, rough, there is paresthesia, muscle cramps, and even you can see that nails become brittle. They break easily. They become very dry. So this is one thing, and people generally complain of polyarthralgia, joint pain. Even before thyroid could begin, many people, they come with the most common presenting symptom is joint pain. I don't feel fresh. I have a lot of pain. I feel tired during the day. I have lethargy. So these are the symptoms with which generally hypothyroidism patient present to us clinically. And yes, weight gain, not to forget, coming to the GIT part, there is weight gain as well. Constipation. Okay, so no matter whatever they eat, whatever diet they follow, how much of exercise they do, they tend to gain weight. So this, what happens basically is metabolism is reduced in hypothyroidism. Face becomes swollen. There is swelling of the eye socket. Hoarseness of voice is there. Voice becomes totally rough and deep. And as I said earlier, there is a lot of lethargy, fatigue, memory impairment. And generally it is seen that people 10% of the people who are diagnosed with type 1 diabetes mellitus are generally associated to have hypothyroidism. Type 1 diabetes mellitus, about 10% of the people who have hypothyroidism, who have type 1 diabetes mellitus, they are more prone to having hypothyroidism. And people who are diagnosed with hypothyroidism, they have problems with depression. They have low mood swings. They feel like crying without reason. They have a lot of mood swings that is happening within them. So that is one thing I wanted to share. And hypothyroidism people, they are generally associated with fertility issues. Many of the women come to our clinic and say that I'm finding it difficult to conceive, okay, or repeated abortions. Okay, it is generally seen in hypothyroidism. It could be one of the cause for repeated abortions or infertility in women. But yes, hypothyroidism nowadays is generally associated with other female symptoms like PCOS as well. Okay, so this is one point which I wanted to mention here. Hypothyroidism during pregnancy. Nowadays, many of the pregnant women are diagnosed with hypothyroidism. See, one thing, hypothyroidism during pregnancy, it is generally very, we can avoid it by properly checking the thyroid profile every 6 to 8 weeks. We can avoid, complications in the neonate. Okay, so this is one easy step we can avoid. It can occur due to Hashimoto's thyroiditis, or it can occur due to over treatment of, see, for example, a lady is having hyperthyroidism. She is on anti-thyroid drugs. And if she is overly treated with these anti-thyroid drugs, you can see hypothyroidism during pregnancy. So when this hypothyroidism is not properly treated during pregnancy, you can see anemia associated. You can have myopathy, lot of muscle pain, arthralgia, spasms, congestive heart failure, preeclampsia, placental abnormalities, low birth weight infants, postpartum hemorrhage, all these complications would be seen. And even you can see a lot of neurological development complications in the neonate as well. So we can easily avoid it if prompt treatment is given. As I said, congenital hypothyroidism, untreated congenital hypothyroidism is very disheartening to see, because it can easily be corrected when a mother is carrying the baby intrauterine. So generally what happens is, in congenital hypothyroidism, you tend to see jaundice, developmental delays, all the milestones are delayed. There is mental retardation, poor feeding, hypotonia, macroglossia, large fontanelles. Okay, so there is closure of these fontanelles is generally delayed. Coarse facial features and short stature. So these are the clinical, this is the clinical picture of congenital hypothyroidism, which is generally seen in babies. Now coming to the investigations part. So we have thyroxine, serum thyroxine, free thyroxine fraction, thyroid hormone binding ratio, serum triiodothyronine, that is T3, free iodothyronine, that is FT3, free T3 index, radioactive iodine uptake, TSH, thyroid peroxidase antibodies, that is anti-TPO. This anti-TPO is very crucial in diagnosing Hashimoto's thyroiditis or autoimmune disorders. Normally, it is supposed to be within 9. If it exceeds, then it's a person is suspected to have autoimmunity. Then free thyroxine index, that is FT41. In addition to the investigations I have mentioned here, generally it is advisable to do FNAC also. See, from my experience, I would want to share here. Generally, a patient had come to me with a nodular goiter. So I kept on treating for, because of which she had hypothyroidism symptoms and other problems associated with it. So I kept on treating her for hypothyroidism. Then I asked her to get one USG guided FNAC. It came out to be cancerous. So I would personally suggest everyone, if we are managing nodule cases, it is better to always get FNAC done, at least yearly once, to see if there is any unwanted pathology or unsuspected pathology that we are missing upon. On a lighter note, when a patient comes to us, they would have done the diagnosis through ChatGPT, Google, and everywhere. And when they come to us, they just come for cross confirmation, whether we know things or what. So this is how the side effects of artificial intelligence and side effect of technology. I just hope one day our consultations won't get replaced by a robo or artificial intelligence. Okay, now homeopathic approach. So we all know homeopathy is a system of medicine with holistic approach. We believe in treating the patient as a whole, not the disease part. So some people are more susceptible to develop certain diseases when compared to others, depending upon their constitution. Certain constitutions are more prone to get certain type of diseases when compared to the people of other types of constitutions. In Organon of Medicine, 6th edition, 5th aphorism, Hahnemann says the importance of constitution in the treatment of chronic diseases. In chronic diseases, Dr. Hahnemann mentions about the obnoxious matter which pollute the organism in chronic diseases. He referred to these agents as miasms. These miasms are known as the fundamental cause of chronic diseases having hereditary influence. Dr. H.A. Roberts, he states similar remedy or the similar disease can, with the similar susceptibility, establishes immunity. As hypothyroidism not only affects a particular part or only the thyroid, it affects the entire person as a whole. That is why the concept of individualization or the constitutional remedy comes into picture. So here, while treating hypothyroidism, we consider the concept of constitutional treatment, where we consider the patient as a whole and not just a part. So there are many remedies for treating hypothyroidism. Okay, I'll be just mentioning few of them, just a brief intro, so that we can at least understand the wonderful remedies what Dr. Hahnemann has given us. Calcarea carb, it is an excellent constitutional remedy. Its chief action is on skin and bones. It has affections on pituitary and thyroid. It is typically suited to people who have scrofulous type of constipation, scrofulous type of constitution, who take cold easily, who are chilly people, children who grow fat, who have a large belly with, large stomach, chalky look. That is the leukophlegmatic temperament, which we call, and all the ailments from working in water. Patient is extremely sensitive to cold. They cannot take cold easily. Chilly people, partial sweat especially on head. They crave eggs. They crave for indigestible things. They crave for sweets. And because of that, they are prone to diarrhea. Calcarea carb people are fair, fat, and flabby and perspiring. We can think, see, Dr. Praful Vijayakar says that there are two types of calcarea carb constitution. One is fair, flat, flabby type of constitution, and the other, he goes on to describe people with tall, thin but prominent features, like prominent jawline or prominent knuckles. Their bony prominences are more marked. Children who grow tall quickly, they more perspiration due over the head, especially while sleeping or on lying down. They are chilly people. They are thirsty. They have desire for cold food. Fair and white complexioned people. It doesn't mean that you cannot give calcarea carb for a people who is, for a lady or for a man who is dark skinned. No, it is not like that. It is best suited to people who have fair and white complexion. It removes the tendency for recurrent boils and suppuration. They crave egg, milk, and dry roasted things. And they walk very slowly. So this is the physical appearance of calcarea carb. Mind, they are very apprehensive. They have a lot of anxiety. Anxiety, especially again about the infectious diseases. They fear to eat outside because they think that they might end up with some kind of infectious diseases. They have fear of poverty. They have a fear of losing people. They have fear of darkness. They have fear of losing money. They are afraid to make any kind of decisions. So they are highly insecure people. Okay, so they completely depend upon their parents, their family members, their teachers, their mentors, their gurus for making decisions. They want support for everything they do. They want support. They are looking constantly for support. So this is the red line symptom about calcarea. And calcarea ka people, they are usually very intelligent. But when it comes to mathematics, they have weak aptitude. They cannot perform well in maths. And as I said, they cannot take decisions because they are afraid that they might take some wrong decisions. So because of that, they don't end up taking decisions. They depend upon their parents, they depend upon their family members, they depend upon their peers for decision making. They are business-minded people. They have fear of losing money. Generally, what happens is calcarea ka people, they want shift jobs. They say, what they say, something is better than nothing. What if I don't get job again? So they stick on to the same job for a long period of time. So this is one thing which I would like to mention here. And as I said, they always need support. They are very sensitive to rudeness. This is another red line symptom. They cannot see horrible things, sensible things. They cannot see animals being tortured. They cannot see children being tortured. They cannot see blood. They cannot see fights. They are very sensitive people, highly sensitive people. They are sensitive to rudeness. They cannot see anything which disturbs their mind. Modalities: aggravation from mental or physical exertion, ascending, and taking cold in any form. As I said, they are highly chilly people. They cannot take cold in any form. And they generally end up very quickly with tonsillitis. It is an excellent remedy for kids who are suffering from tonsillitis immediately after taking something cold. Full moon and standing. All the problems they get aggravated in full moon and while standing. So this is about calcarea ka. Next remedy is calcarea iode. Just a minute. Just a minute, ma'am. My screen is visible?
Yes. Calcarea iodide. Yeah,
Okay.
now.
Now it's visible. Yeah, there was some problem. Sorry. So calcarea iode, it is extremely useful in the treatment of scrofulous affections, especially enlarged glands. This remedy has beneficial results. Thyroid enlargement, it is a specific remedy for enlarged thyroid gland, especially during puberty. Flabby children who subject to cold, secretions are generally profound. And generally, these people are very impatient and restless. They are mentally restless, but they are physically very weak. They are hot. The iode element in calcarea makes these people hot, and they have desire for open air, but they are very sensitive to wind. They cannot go out in open wind. It generally causes them headache. And this is thing. And one more red line symptom is it is generally suited to women who suffer from thyroid problem during puberty and during pregnancy. We just spoke about hypothyroidism during pregnancy. So this remedy works well in women who end up with hypothyroidism in 2 phases of life, that is in puberty and in pregnancy. Calcarea iode has same amount of changeability like that of pulsatilla, but pulsatilla is thirstless, calcarea iode is thirsty. Okay, and best suited to young boys and girls who wear trendy clothes. This is about calcarea iode. Next remedy is graphitis. Graphitive people are generally stout and of fair complexion people. They have tendency to skin affections. They are generally constipated, fat, chilly people. Their menstruations are generally delayed. And when we shake hands with these people, you will see a strange amount of roughness of palms. Whereas in calcarea ka, if you shake hands with them, their palms are generally very soft. So this is according to Praful Vijayakar sir. He says These people, graphitis people, they have a strange amount of roughness in the palms, whereas calcarea cup people, they have very soft palms. So changeability, graphitis also has changeability like that of pulsatilla and calcarea iode. They are apprehensive people. They are anxious. They are sad. They are very timid. They cannot make decisions because of timidity. They do not like flowers and they are very sensitive to music. They do not like flowers and music. They are very timid people. But how do they remove their timidity? By passing sarcastic remarks. Sarcasm is more marked in graphitis. Children, impudent, teasing, they laugh when they are reprimanded. Then it is an indicated remedy for goiter with difficulty in swallowing. They feel a sensation of lump in the throat, which makes the patient to swallow continuously. And there is a spasm in the throat while swallowing, because of which the patient constantly retches. And this graphitis, it removes the tendency to erysipelas. There is aggravation at warmth, at night, during and after menstruation. They are better in the dark and from wrapping up. So this is about graphitis. Next remedy is iodum. Iodum is an excellent remedy for hypothyroidism. Here, the metabolism is more marked. Generally, we see that iodum patients are very lean and thin with increased appetite. Their lean stature or their lean appearance is just because of the fact that their metabolism is very high. They have loss of flesh despite eating well. There is great debility. Slightest effort also causes them to perspire. And iodum individual is very thin, dark complexion with all the glands enlarged. They have ravenous appetite. They feel hungry all the time. But eating does not make them feel better completely. It just ameliorates them. And after a while, they feel again hungry. All granular structures like respiratory organs, circulatory system, they are all affected and they are atrophied. And coming to the mental generals, they have anxiety. They have a lot of anxiety and depression, not thinking about future, about present itself. They are very anxious and depressed. They have an impulse to run, to do violence. They are forgetful people. They want to keep themselves busy. And they have fear of people. They close everyone. They shun everyone. Okay, there is suicidal tendency. There is a lot of melancholy, sadness. So basically, iodum is an excellent remedy. It acts very well on thyroid gland. It causes enlarged thyroid, goiter with sensation of constriction as if something is holding. And all the maxillary, submaxillary glands are swollen, uvula is swollen. Modality is aggravation when coit, in warm room, right side, walking about and in open air. So this is about the iodum. Next remedy is natramure. Natramure, we all know, the entry point for natramure or the confirmatory point for natramure is sun aggravation. They cannot tolerate sun. When they go out in the sun, they have headache. So when you're thinking to give natramure to a patient, confirmatory points you need to check. One is sun headache and the other is consolation aggravation. Whether they feel better by consolation or they are aggravated by consolation. Natramure gets aggravated by consolation and they cannot tolerate sun. These are the two confirmatory points. And natramure has a tendency to produce anemia. There is great debility, weakness, fatigue, tiredness, weakness in the morning, and there is a lot of emaciation as well. And here the emaciation is more marked in the neck region. And they have a tendency to take cold. There is dryness of mucous membrane. They are oversensitive people. Oversensitivity to what level? Even at mental level. They are very sensitive people. They have that fear of getting hurt. They do not want to hurt others also, and they have that fear of getting hurt also. So that is the reason why they are introverted people. They do not share, they do not express, they prefer being alone. That is the thing. And it is an excellent remedy for hypothyroidism, goiter, Addison's disease, and diabetes. Mind, as I said, they are introverted people. They prefer being alone, and ill effects of fright, grief, anger, and they are better by being alone, by crying, and there is tears with laughter, and aggravation by noise, music, warm room, lying down, consolation, and sun. So as I said, sun headache and consolation aggravation. These are the two confirmatory points for natremure. Another remedy which comes very close to natremure is borax. And they're better by open air, cold bathing, tight clothing, and lying on right side. So this is about natremure. Thyroidinum. Thyroidinum is widely used remedy nowadays for hypothyroidism. It produces anemia, emaciation, muscular weakness, sweating, nervous tremor of face, limbs, tingling sensations, paralysis. There is exophthalmos, dilatation of the pupil. It is more beneficial in myxedema. There is thyroid weakness and with excessive desire for sweets, goiter, there is obesity. It acts better with pale patients when compared to that of high color. And they are very much sensitive to cold. The thyroid people in general, they have increased sensitivity towards cold. And there is weakness, there is fatigue, weak pulse, and cold hands and feet, palpitations, low blood pressure, chilliness, and it has a very powerful diuretic action in myxedema. Mind, there is stupor, alternating with restless melancholy, irritable people, worse least opposition, and they go into a state of rage over trifles. Small things, they make them so irritable, so angry that they go into a state of rage. Rage is nothing but extreme, I can say one stage ahead than anger. So now let us come to the case part. So I would want to discuss one case who a lady aged around 48 years, married. She's basically a homemaker. She came to me with complaints of scanty menses since almost a year. And she complains of body pain on and off since almost 6 months. She says her body feels heavy. She does not feel that amount of freshness, she says. And there is weight gain since 4 months. She's recently diagnosed with hypothyroidism since 3 months. She's not on any allopathy medication. She has palpitations on and off occasionally. When I took her past history, there was nothing significant apart from history of typhoid 2 years back. So this is the thing. And I took her family history. It says a father has heart issues, mother has hypertension. So basically, heart issues are running in the family. Personal history, appetite was normal, thirst was found to be normal, sleep was found to be good. Thermals, she says she was better, unable to bear summers before. Now she cannot tolerate winters. See, I consider this as a basic symptom of hypothyroidism where there is cold intolerance. So generally, I don't take thermals when in case of hypothyroidism. So life space investigations and giving in patient's language. She was born and brought up in a middle-class family in Bangalore. She studied until 8th class in Bangalore. She had a lot of financial issues after marriage. She feels bad that she could not help her husband. Her in-laws didn't give her a share in ancestral property. She says that the property was not divided properly. She had her share, but her in-laws didn't give her share. And so that is the reason why she had to face a lot of financial issues in her with her husband. This is what she says. She has, because of this, she has a lot of anger towards her brother-in-law and sister-in-law, but she does not express her anger. She keeps it to herself. She has 2 children. Both of them are studying very well. She says she feels very good to see them succeed because she didn't get at least she feels happy because she didn't get, her children are getting to study. So she feels good if she sees them succeeding. She wants company. She says she cries easily when on seeing emotional scene on TV. Her husband says one thing which is very striking. He says that she's very bad in keeping secrets. Once her brother had told her that he has an extramarital affair with women, she went ahead and told it to her sister. Brother got to know about it. He does not talk to her since then. Feels bad for what she has done. So the thing is, she cannot keep secrets. So her husband goes on to say that her brother had shared some secret with her and he expected her to keep it confidential, but she went ahead and shared it to her another sister, and because of that there is no conversation between the 2 siblings. So this is one striking symptom which I found, and rubrics that were selected was mind timidity, mind reveals secrets, mind remorse. Remorse is nothing but it is a deep regret that is coming from a sense of guilt from past doings. And depending on that, ammonium carb 200 was given, and PL was given for 1 month. And in between, thyroidinum 30 was given. 5 doses were given here and there. And ammonium carb, on this point, I would want to give few words about ammonium carb. Ammonium carb is a wonderful remedy for thyroid cases. I have seen it acts on the circulatory system, causing sluggishness of blood, produces lividity. Obese people with weak heart, catches cold easily. Physical generals, discharges are very much accurate. They are excoriating. Bleeding is dark red. Hemorrhoids, epistaxis, frowning between eyebrows. So there is nothing but you can see frowns between eyebrows when they are trying to talk. And Praful Vijayka sir says, ammonium carb has a lot of anger like that of Nux vomica. Nux vomica expresses it out, but ammonium carb people, they do not have courage to express their anger. So he says that even it's a very, it has a lot of anger like Nux vomica, he says. They are irritable people, they are obstinate, they refuse to answer. They are abusive and they are discontented. They are never happy, they are never satisfied people. And you can see the result, TSH was around 12.14. And in between, it came back to 7.13. And this is the latest report. It says 0.401. And one more thing I would want to tell, I have personally taken permission from my patients so that I can present it in front of you. And this is the second case I would want to share. A 30-year-old female, married female. She came to me with thyroidism, hypothyroidism since 3 years. She is on Thyronorm 25 mg. She was unable to conceive, married life of 3 years. Consulted many doctors, took IVF also. It didn't help. She was diagnosed with PCOS. She has weight gain since 8 to 9 months. Hair fall since 6 months. She had allergic rhinitis, because of which she took homeopathy treatment for the same 6 years back. Appetite was fine, sleep was good, bowels were regular. Thermals, I could not find something very striking. She says she was able to tolerate both summers and winters. Thirst also nothing significant I was able to find. Family history, there is diabetes, father has diabetes and hypertension. Mother has hypothyroidism. So life space investigations, she comes from Tumkur. She is very bright in studies. She was a topper since her school days, topped her district. She completed her BCom with distinction. She is doing her MCom through correspondence. So with this, we get to know that she is very diligent and conscientious woman, and she is very ambitious as well. That is what we can infer. She wishes to finish her MCom with very good marks and wants to work in a good company. As I said, she appears very ambitious. Says she has completed her education in Kannada medium. Now she is finding it difficult to study in English medium because of the difference in the language. During initial days of marriage, she had taken contraceptive pills. Still, she feels very bad about it, says it is her mistake. So she has that guilt in her mind that in the initial days of marriage, she had taken certain contraceptive pills, because of which she is not able to conceive now, that she has that guilt in her mind. Says her mother-in-law is very dominating. She keeps taunting her for not giving dowry, for not having children. Says she will marry her son again. She does not respond to whatever her mother-in-law says, but gets very much angry by her taunts. She says, if I back answer my mother-in-law, what would be my husband and other family members think about me? She cries when alone. So basically what is happening is her mother-in-law is very dominating. She is repeatedly taunting her for dowry and for not bearing children. She's very angry at her, but she does not express it to her because she has that fear in her mind that if I back answer my mother-in-law, what will my husband and other family members have an image about me? That is what she is very much worried about, her image. That is what I could infer. And says generally she likes company. She's an introvert. She doesn't talk much. She has this fear of cockroaches and fear of lizards. And you can see the difference. It was about 7.11 and later it came back to 3.19. And rubrics that were selected was ailments from anger and vexation, sensitive reprimands. Another remedy for this rubric is Natramure. She is ambitious, so that rubric was selected. Remedy that was selected was Staphysagrina 1M 3 doses. Subsequent follow-ups, only SL was given here. We didn't give her any thyroidinum. And patient, she conceived, she is not on any allopathy medicines. I would want to play this video. I've taken permission from my patients. Is it audible?
Maybe you can
Yes,
increase
yes,
the volume a
audible.
little bit. Yeah.
This is the maximum, ma'am.
ಸೊ ಅದು ತಕ್ಕನಾಗಿ ನಮ್ಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತಾ ಇದ್ರು, ನಮ್ಗೆ ಅದು ಸ್ಯಾಟಿಸ್ಫ್ಯಾಕ್ಷನ್ ಆಗಿಲ್ಲ. ಸೊ ಇಲ್ಲಿ ನಮ್ಗೆ ಹೇಳಿದ್ರು, ನಮ್ಗೆ
ಯಾರಿಗೆ ತೊಂದರೆ ಇತ್ತು? ಅಶ್ವಿನಿನ?
ಅಶ್ವಿನಿ ತೊಂದರೆ
ಏನ್ ತೊಂದರೆ ಇತ್ತು? ಥೈರಾಯ್ಡ್ ಇತ್ತಲ್ಲ.
Anyway, that speaking in another language, no, you will
Okay,
explain.
they only say that after taking treatment, she was able to conceive. They visited so many doctors, they were not able to get benefited. That this is what they were able to. That is what he's telling in the video.
Okay.
This is in Kannada language. Okay, the third case is about a 37-year-old male. He is freshly diagnosed with hypothyroidism since a year. He is not on any allopathy medication. He does not have any symptoms as such. Only problem was hair fall only at the vertex region since 2 to 3 months. Past history, there is nothing significant. Family history, mother has diabetes, father has some skin issue. He says it is eczema. Appetite is normal, sleep is good. And thirst, he says it depends upon the season. In summers, I feel thirsty. This is what he says. Bowels are regular, thermals nothing specific. He says he can tolerate all seasons. So life space investigation, he is born and brought up in Bangalore. He studied until 10th class. He has no interest towards studies. He is not working. He does not like doing job. Whole day he just spends by sleeping, roaming with friends, going to gym. He gets angry easily. He shows his anger only towards his wife and his son. He stays in a joint family with his parents and his brother's family. Father takes care of him and his family. Wife says wife is literally fed up. She says, "Ye kya nikamma hai, kuch kaam nahi karta hai." This is what were her words. Wife says his anger is very bad, which he shows only on her and her son. Says he is very dominating towards them. Wife says he does not like if his younger brother is in good post, earning well and settling down. So basically he's not earning. He's not doing any kind of job. He's completely dependent on his parents for taking care of him and his family. And if he sees his younger brother who is earning very well, who is in a very good post, he does not like it. He keeps on comparing himself to him and he says that he is incapable. So this is his thing. Wife is fed up with him not working. He cannot take decisions on his own. He has fear of failure, fear of lizards. He enjoys company, especially friends. That is what he's doing since entire day. This is what wife says. So rubrics that were selected was aversion to work, envy, and dominating. And lycopodium 1 mg 3 doses were given and PL was given, because of which thyroid also came down. 3.5. So I want to say that in hypothyroidism, homeopathy works simply like a magic. I have seen people recovering very well with homeopathy. Hypothyroidism cases respond very well to homeopathy. But what I do, if they are taking any Tyronorm 100 mg or 75 mg, I completely do not stop them. I taper the doses. Instead of 100, I make it 75, then 50, then 25, then 12.5 and completely stop. So this is my approach of treating hypothyroid cases. Hope I was able to convey some knowledge which I have, little bit of knowledge which I have. I would again want to tell something. I would want to thank Dr. Praful Vijayakar sir for guiding me, Dr. Vijay Krishna sir for being my teacher, my guide, and not to forget Basil Yusuf sir for his constant support. And I would want to thank my parents and my husband as well.
Thank you, Dr. Afshan. It was really enlightening session, and really thankful to the knowledge that you have shared here. We have 10 minutes. If anyone have any questions, you can ask. You can stop the screen sharing, Dr. Afshan.
Yes, ma'am.
Dr. Hariharan has raised. Doctor, you can ask. Please unmute yourself and ask.
Okay. Can you hear me?
Yes, sir,
Yes.
you're audible.
Doctor, your narration is very good regarding hypothyroidism. See, I like to ask one question.
Sure, sir.
How will you manage in certain cases they have the hereditary background? That is the first question. Next,
Sir, I didn't get you, sir. Could you please repeat?
see, how will you manage the cases which are they having hereditary background? That is the first question. And another question is that in such cases there may be TPO, anti-TPO. So
Yes.
such cases, what is your approach?
Yes,
I
sir.
like to.
Sure, sir. Thank you for your question, sir. So basically, for autoimmune disorders, I consider the rubric, I prefer to enter the case by syphilitic rubric. Generally, I take the case in detail, repertorize it, and try to enter the case by syphilitic rubric, individualize the case, and based on totality of symptoms, I generally give the remedy. And in between, sometimes it so happens that despite giving the best constitutional remedy, patients don't respond. And in such cases, I generally put an anti-miasmatic remedy in between. Antipsychotic.
Most probably which will be the miasmatic remedy?
Generally, I have used Tuja, sir, most of the times, or Medorinum also. In most of the cases also, the Medorinum has also helped. And depending upon the case and depending upon how well the improvement has taken place, based on the totality, I generally prescribe either of them.
Okay. Okay, very good, very good. Very good. Your narration is nice. Thank
Thank
you.
you, sir.
Thank you,
Thank you,
Dr.
sir.
Hariharan. Now, Dr. Danesh, please. And you have a question in the chat box also. Okay, doctor, you can continue.
Thank you, Dr. Rajini, and thank you. An excellent, wonderful presentation from Dr. Afshan. Really, you show that you are really a brilliant doctor, and you got the guidance from Dr. Vijay Krishna. He took one session in our forum last some 2 years back, but still he's missing here. But we are trying to bring him back here. You can also make sure that sir will be your master or your sir will be coming over here, because
Yes,
you
sir.
have
My
that
teacher.
you are as equivalent as your master. That's what I would what I have noted in this.
Means a lot for me, sir. It really means a lot for me.
You studied
Thank you very much.
subject very well, and not only that, you took the case in details and you find the right rubric, and you choose the right remedy and right potency, and you won the game in the shortest possible. How much time it required to the case to be cured?
Sir, in some cases, I have seen result within
In this particular case, how much time you required? You really.
the last male patient, it just took 3 months, sir, to see the
Okay,
change.
that's really wonderful. But nobody could believe that homeopathy, because we have seen such wonderful cures with some in our clinics also. But this is really absolute. A junior doctor like you who makes such a wonderful cure within 3 months. That
Thank
is,
you, sir.
and if the patient is in the other side, they will have to take the medicine for their life long, and they will have to increase the medicine every yearly or half yearly, or sometimes 3 yearly, and they may come with thyroxine 200 like that after a
Correct.
long time. But still, there is every chance of increasing the TSH level. But this is the beauty of homeopathy. In homeopathy, we treat the patient, and once we treat the patient, we definitely get the cure. And that's what you have proven in this forum. Once again, congratulations, and all the best. Hope you can have some more presentation in the future.
Thank you, sir. It really means a lot. You made my day, sir. Your comments made my day. Thank you very much.
Thank you, Dr. Danesh. And Dr. Ram Parvesha.
Thank you, Dr. Anjani, and congratulations, Dr. Afshan,
Thank you, sir.
for your valuable support and guidance in our presentation on hypothyroidism.
Thank you, sir.
Hypothyroidism, deep study. Your hypothyroidism, primary and secondary hypothyroidism decrease the T3 and T4. But main cause of disease, invisible, dynamic, emotional, hypothyroidism, emotional, and deficiency of electrical disbalance,
Correct.
lifestyle. Hypothermia due to iodine deficiency. So very kinds of medicine describe the calcarea car, lycopodium, and very good case presentation, case evidence-based case presentation.
Thank you, sir.
Lycopodium, calcarea car, etc. So very thanks, Dr. Afshan.
Thank you. Thank you, Dr. Ram Parvesha. Now I am inviting Dr. Abida Salam for giving vote of thanks to Dr. Afshan. Please.
Hello, everyone. Thank you, Dr. Afshan, for your wonderful presentation.
Thank you.
The way you have taken the case in detail, and initially you had even given detail about the pathophysiology of hypothyroidism, and the presentation was really wonderful. I liked the way you have, gone from the everything in detail, including the investigations and everything, and you have added on everything very well. Keep up the good work, doctor, and thanks to all.
Ma'am, it means a lot.
Thanks to everybody who has been with us. Even the host, Dr. Rajini, also, she has been managing many people who are entering in between. So that is also, you have to keep, adding everybody. Thanks to Dr. Basil for giving everybody opportunities and bringing up everyone to such and introducing to these platforms. And thanks to IFPH, especially for all these opportunities. And to all doctors who have given their side and questions and blessings, everybody. And of course, I would not forget my father also, who is like a pillar everywhere, trying to promote IFPH and wherever. And
Thank you.
everybody, I don't want to say by name because there's time is also less. Plus, I don't want to miss out on anyone. To all those working behind this, thanks a lot.
Ma'am,
Thank you.
could I say something?
Thank you.
Dr. Basil sir has been my support. He's been messaging me and giving me all the possible support. I would wholeheartedly want to thank him. He's given me an awesome platform to present myself. I'm very much grateful to him, actually. Thank you very much, sir.
Thank you.
And Dr. Bob Lim, please.
Yeah, I would like to congratulate Dr.UMMAI AFSHAN from the Dr. Basil Homeopathy Hospital, who has successfully conducted the 1,715 day of uninterrupted webinar. It has been a very fruitful case-taking cases that has shared and a very good, insightful into hypothyroidism. Hypothyroidism with a homeopathy is definitely a very interesting and a difficult subject to deal with. And congratulations, Dr. Afshan, for being so successful in this field. Thank you very much for your information and insight. Over to you, Dr. Ajini.
Thank you, everyone. Thank you, Dr. Afshan, once again.
Thank you, ma'am. Thank you once again.
Now we have to move to the Malayalam session. So thank you, everyone, for your valuable presence here, and let's work together. Thank you. Bye-bye. Good night. See you tomorrow the same time. Bye. And I'm inviting Dr. Mariamma John for moderating the Malayalam session. Doctor, please.